Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Before we get started with our guest today, I want to make sure and give a big thanks to Hubbard Radio for allowing us to use their recording space and being such an amazing partner. Today, we are here with Callan Montgomery. Hi, Callan.
Hello.
How are you today?
Good, you?
Doing well. So Callan and I have known each other forever?
Probably a decade or so.
A decade or so, at least, yeah. And Callan is the director of Haven Recovery, which we'll learn all about. But also, here in the month of September, it is known as Recovery Month. So we're going to talk a little bit about Haven Recovery. We're going to talk about Recovery Month and kind of unpack what all that means. But first, do you want to introduce yourself a little more than I just said?
Sure.
Who are you, Callan?
Thank you. Callan Montgomery, as you said, director at Haven Recovery, co-founded with my husband about 8 years ago. So we have been in the St. Louis community for that whole amount of time, doing a variety of recovery, treatment, housing, different types of health offerings, street outreach, homeless outreach. So we try to cover a broad range of activities. But my background is in public health, and then my husband's a person in recovery, so that's kind of how we got into Haven and where it started and why we're so passionate about the work that we do.
Yeah. So going back, so since you mentioned it, how you got started, what was kind of that path? How did you one day just decide, hey, we're going to look into how we open recovery homes for people and how we're going to get into this world? Where did that come from?
Yes, that's quite a long story. I don't know if it'll fit on a podcast, but we met. I was working in a substance use treatment center, working on my master's in public health and focusing on substance use, and then met my then husband, who was working as a peer in recovery, and went through some journeys through the substance use world, which if you're a part of, can sometimes be really difficult. But
a little bit of a roller coaster.
A lot of a roller coaster,
mm-hmm.
Yes. Lots of ups and downs, but came out on the other side and got to see his recovery progress. And part of that was due to housing. And that was my work and my background that I wanted to be involved in, and didn't know I would learn so much real world information about it, but learned a lot that way too. And so through education and life experience, literally, like you said, one day wanted to do housing. He had such a positive experience with it. And then I was working with females, and there weren't a lot of female housing options at the time. So really there were none that were accredited or allowed medication or kind of focused on different pathways to recovery or more pathways to recovery than one. And so that was our first goal, was women's housing. And so that's what we got started in. And we did accreditation from the get-go and try to incorporate science and evidence while we're personally passionate about it, still try to incorporate those principles that are proven to make
mm-hmm.
it beneficial and successful for people.
Yeah, I mean, working, I think, in any space in behavioral health, it's the art and the science, right?
Yeah,
yes. You have to have the data and the knowledge and the understanding, but it's also really the art of working with human beings and individuals and making it a space that they can thrive into.
Mm-hmm.
So recovery housing. So for people that might not be as familiar with what does that mean, or, I get the question around, like, is that like a halfway house? Is that like what does that mean, recovery housing, or what does it mean to you?
So for Haven, it is a house where people can get healthy, build their life, and be happier, productive members of society and build the life that they want the way that they want to. So when we first opened, I don't think that there were any houses in Missouri that were taking individuals who are using medication mm-hmm. on their recovery journey. So that was very important to us. So we have always accepted all forms of MAT, of medication-assisted treatment, from the get-go, and also worked to be accredited because we're asking a lot from people, like we're holding them to a high standard, and so we wanted to hold ourselves to that same standard. So went through the accreditation process, state and national level, to make sure that we had a sense of accountability for ourselves, since we were asking that from others. And so what we ask from people really is to do their best and whatever that looks like. And that's going to look different for everybody. That may include medication. It may not. It may include therapy. It may not. It may include going to meetings. It may not. There's all these varieties or all of these different things that people can incorporate into their life that make their life better.
Right.
And that's what we want to see for them, is just them creating a life that they love. And for us, typically, that is free from substance use. We have expanded some that to other types of housing that incorporate more of a harm reduction focus. But recovery housing is, of course, with the name, focused on recovery.
Right. But for some, their journey might involve some recurrence at times.
Yeah. So how can we address that, and how can we still be supportive and make sure that people aren't, something happens in life that's really difficult and there is a recurrence. How can we support them through that instead of, well, now you're homeless. You had one difficult situation and now here's another compounded on top of it, right? That's not helpful. So wanted to make sure that we could do that in a way that's safe for the whole house, safe for everyone, but that also encourages and supports individuals when they do have a struggle or a tough spot.
Yeah. So where did the name Haven come from?
Haven, well, that's not an interesting story. When we first started to think of opening, we wanted to be a safe place. And so we just started looking up words that kind of meant that. And so the definition of haven is a safe harbor. And so that's, when we read that, I think it just kind of stuck, and we were like, oh, haven, that is the perfect, we want to be a safe harbor in troubling times. I think that's the exact definition. I'd have to go back and look it up, but
no, that's really beautiful.
So we read it and we were like, oh, that's exactly what we want to be, is a safe spot when people are going through a hard time. And so it seemed like the perfect word.
I love that, actually. Thanks. You said it wasn't a good story, and it's really a great one.
Google.
That's okay. That's sometimes it works that way, that it doesn't have to have, that tremendous story behind it, but it still has a lot of great meaning to it. So what does Haven Recovery look like today? Like what kind of houses, what kind of work, what kind of outreach are you focusing on?
So we started with our one women's recovery house, and we housed about 10 people. And since then, so over the last 8 years, we've housed a little over 1,000 people through recovery housing. So that's exciting. Really glad to be able to offer it. And we did expand to men's as well, so men and women for recovery housing. And then
So how many houses? Is it 2 separate houses, or?
Yes. Men and women are separate. And we at one point had up to 8 houses. We're at 6 right now, but we have expanded also outside of recovery housing, expanded to different levels of housing as well. So trying to have a kind of a continuum of offerings. And so we have our Next Step apartments also. And so those are, individuals can go through our recovery housing program or not. They can just get referred to us from the community, and they can go to those apartments and kind of continue next steps in life. And what does that look like? So after that initial kind of treatment path, perhaps, if that was their journey, and then in recovery, and then what are you building long term? So where are you going to live, building that rental history, credit history, work history, so that individuals are able to either rent a long-term place themselves or perhaps buy home ownership, financial education. So gives them that next step of independence while keeping a sense of community and support also.
So it is kind of that intermediate step between like a community recovery house and then, but just kind of being totally on their own.
So they can live, it can be a single or it can be a double, but still has everyone in the apartment complex is focused on building a better life. So you have people who have a common goal. And then kind of going the other end of the spectrum, we have also incorporated a lot of outreach services. So we have our street outreach team, we have a wound care van, so we get to go to the homeless encampments and work with individuals who are most likely not in their recovery journey yet, or may never want to be, but still deserve resources and compassion and services and just a sense of community also, even though it may look different than what we've maybe been trained or kind of told that it should look like. So that has been a really interesting piece to incorporate, but something that our staff were really, they were very, very passionate about. my family's very passionate about. So we wanted to make sure that we were serving those individuals just as we would anyone else.
Absolutely, yeah.
Yeah, so we have the street outreach, and then that also led to the incorporation of respite housing, which was peer-led for individuals who weren't sure of their recovery journey at the time. And so they could come for 1 to 2 weeks and get connected, really deep dive into services really quickly, and get connected or reconnected to wherever they had been previously, or if they hadn't had services in the past, get connected that way, but gave them kind of a landing place to determine next steps. And even if recovery wasn't their path, how can we still help you with, primary care, prevention resources, harm reduction resources, all the different types of things that can still be helpful and useful, food resources, a lot of different things. So how can we connect them? And so that kind of laid a groundwork for a statewide respite model. So I think there are 6 now, which is exciting. And then when we were doing that, we also found there were a lot of individuals also with physical medical issues. So maybe a cancer diagnosis, or needed to start dialysis, or a new diabetes diagnosis, wound care, infection, broken bones, whatever, lots of medical issues. And so we didn't know that it was a national model, but there is a national model it's called medical respite housing or recuperative care. And so that's for individuals who are experiencing homelessness and have some sort of acute medical need, which often, not everyone that comes to this location has a substance use disorder, but a lot of times that is kind of part of the story. So it's that intersection,
some history or misuse of substances to help cope with the medical.
Right. Which came first, the chicken or the egg? Does it really matter? It's all part of the story sometimes. So substance use doesn't have to be a part of that. It's really homelessness and medical needs that we're focusing on their healing for, but 90% of the time that is coupled with substance use disorder or misuse. So that has been going on for about 2 years, and we've shown thus far a 94% reduction in homelessness.
Wow.
Yeah, and an 85% reduction in substance use.
That's incredible.
So, yes, we're really, really pleased to be able to offer that, and very excited about the results. So that's
so it is a national model, but there's not a lot of those options in this region, is there?
There are none. No.
Well, now there's one.
Now there's
right?
one. Yeah. Yes. There were none in Missouri, and so we started the first one in partnership with SSM, and then got to grow it with Behavioral Health Network, and all 3 of our hospitals are now involved. So BJC and Mercy, and lots of many other community partners as well. But first in Missouri, and we just got CARF accredited.
Yay! So, congratulations!
Yeah. So not only our region, but in the whole country, there's just one other. So there's one in Connecticut.
Wow.
But,
So for those that don't know, CARF accreditation is a heavy
tough
lift.
Yes.
It's not just like filling out a form and sending it in. It is.
It's a 4-day visit. They're constantly on you.
And it is making sure all of your I's are dotted and your T's are crossed, which is necessary. I mean, that's what
absolutely.
It should be.
Yep.
You want it to have a standard, but I know that it can be quite the process to go through.
Yeah. So we were very excited to meet those standards and just know for ourselves that we're offering a high quality service when sometimes, things are tough. It's a tough field, and sometimes services fall a little short of what I would expect. Right. So I want to offer to everyone, regardless of payment method or life circumstance, what I would expect, and that is high quality.
So we're not ending here, but I think it's a good place to plug this before we pivot the conversation just a little bit. If somebody is looking for a resource for themselves or a loved one, or connect with Haven Recovery, what's the best way to do that?
So we have a 24/7 phone line, so they can always reach us. I should probably know the phone number, so we can post that. And then they can reach out to us on social media or through email on our website. There's a form as well.
Okay. And your website
is havenrecoverystl.com.
havenrecoverystl.com. And there you can find the phone number. Yep. You can find contact information. You can find more information about all the services that Haven Recovery offers. Usually the website's the go-to place to learn more. Excellent. So we also, because it's September, and September is Recovery Month, what does that mean to you? September Recovery Month is, what all do you get involved with for that? Or, what do you see happening in the community during Recovery Month?
Yes, lots of things. It's very exciting. Like I said earlier, have worked in this field for almost a decade now, a little more, and there were not a lot of recovery. I didn't know that it was Recovery Month until probably 5 years ago.
Okay.
When I was working more at a national level with SAMHSA. So SAMHSA, Substance Abuse and Mental Health Services Administration, they promote this across the country, so Recovery Month. And their goal is to educate the public on substance use and mental health, and also celebrate the accomplishments of individuals who are in recovery. And so we obviously, this is what we do every day, is work in recovery. And there were a couple events in St. Louis and across Missouri. Many were very siloed. We support this method of recovery or this pathway, but not this one. And so we wanted to have an event and a celebration across the whole month that really exemplified every stage of recovery and every pathway, and that
there's no right way. There's no wrong way. There's no right way.
Yes. Yeah. As long as you are bettering your life, that's it. That's all. Yeah. That's the definition. Recovery there is no mention of use or, targets, or you need to decrease this or that in the definition that's provided by SAMHSA. It's literally bettering your own life. So that's our hope for everyone. And that's what we hope to celebrate through September. So we do participate in the other events that are happening. There are some groups that have them events across St. Louis. There's one in Kirkwood. There's one downtown, Recovery Fest. Yes. So we participate in those, and then we host our resource fair. And this year we're adding a carnival to it. So we try to make it, so we're really excited. We try to make it fun for everyone and accessible to the community, so anyone can come. Because part of it's celebrating recovery, but it's also educating the public, educating the community on what substance use is, what recovery is, what the resources are available, what resources are available out there. And so we want to make it inviting to everyone, not just the recovery community or the substance use community, but really our whole community. So we have people from across the state. We have people coming up this year from Kentucky to go to the Cardinals game. So the Cardinals partner with us to have Recovery Day at the ballpark, and they promote a lot of recovery information. September 21st. It's a Sunday. It's an afternoon game this year. So we're hoping it'll be cool and not too late, because we have a lot of kids that like to join too. So we tried to pick a different time this year. So Sunday, September 21st. I think it's a 1:15 game. It's against the Brewers.
Okay.
Excited for that. And that's a really good way to get information out there and let the public know, just, if they do need resources. So we share our resources, but then we also share all of our partner resources as well. So a long list of providers in the community. And then following that, we'll have on September 27th from 11 to 2 at Carondelet Lions Park, we have our Recovery Resource Fair, which will have the carnival that I mentioned. So we'll have rock climbing wall and snow cones and cotton candy and carnival games and fun for all the kids and all the families, because we want people to see that recovery, substance use, while it obviously has its dips and its downs and its negative side, there really is community after, and even community during, if someone is still in that struggle, and we want people to see that it's not dark, it's not scary, it's everyone's still a human, and so we can all come together and truly have unity within our community and try to understand each other and the whole system and the whole process of substance use and recovery. So try to make it fun, inviting, welcoming to everyone.
Yeah, you've said a couple times, you said like share information or educate the community. And I also hear when you're saying that and you're describing it, it's really about reducing stigma.
Yes.
And not just reducing stigma, as I'm listening, it's not just reducing stigma of what is a substance use disorder, right? Or what people's perception of that might be, but also reducing the stigma of who is connected to substance use and how people can connect to resources and what type, even within your own housing journey that we talked about with Haven Recovery, it's not just a cookie cutter, and there's not just like one way that you do this and it works or it doesn't, and then people, you don't just throw your hands up and say that's it. So really breaking down those barriers of what people know or think they know about substance use and recovery.
Yes. Yep. a lot of times it might be an individual, people think of a needle and homelessness and that can be part of it for sure. But, I don't drink alcohol. Alcohol had no positive place in my life. A lot of people don't look at me and think of recovery, right? And then there's also, of course, all types of other drugs. So heroin and meth and all types of things, pills, mental health struggles too, where maybe substance use wasn't even a part of it. But that is part of Recovery Month too, is celebrating that mental health recovery piece, and making sure that we're promoting those resources as well, even outside of substance use. So definitely changing kind of how you look at it and what people see when they think of it, right? We want people to think of recovery and think of goodness.
Right. Yeah. Think of good, think of fun, think of, I love the carnival aspect, connecting families and people, that this isn't something that, just kind of happens in the shadows and the whispers, but, people are living their best lives, and that's something to celebrate every day.
Sure.
Yeah. So SAMHSA really helped promote this, but I think many places in the community have embraced September as Recovery Month, and
definitely.
And I think it's a great thing, and gives us just more opportunities to celebrate, talk about all of those pieces that come with it. That's really
and
cool.
Showcase the accomplishments of people who are in recovery. And so that's kind of our last day is September 30th, and that's National Recovery Gives Back Day. And so as all across the country, people do different types of volunteer services in their communities. And so we have done for the last 3 years, partnered meals and taken them to Mo Network, an organization that does some harm reduction work, taken them to homeless shelters, different places that might need meals, but we partner with United Healthcare and BJC and lots of bigger organizations that can come make these meals and know that they're going directly out to the street, right? Sometimes we get, I think, in our offices and things, and it feels like it's a good way to be back in touch with the community. So we have a lot of organizations that come and volunteer. They'll be organizing Christmas toys for our kids. We do a community Christmas drive, making lunches, visiting the homeless encampments. We'll have our shower trailer out, doing offering hygiene care for individuals that might not have access to that. So it's a really fun day, and it's again September 30th. People can sign up on our website. There's a spot for that. And so we would we'd love to have them. I think we have about 150 people signed up so far, so lots of volunteers, lots of different options of things to do, and just a good way to see others in recovery giving back, and also kind of give back to those who might still be struggling.
Right. And I'm going to assume, but I know it happens sometimes there, so I'll say this and you can correct me if I'm wrong. But volunteering for something like that, it's not just for people in recovery. I mean,
true.
Anyone could come volunteer?
Yes,
is that true? Okay.
Yeah. Most of our volunteers, maybe a lot of our volunteers last year had no idea. We had a lot of physicians that wanted to learn more, but they have a lot of patients that this impacts, and so they wanted to learn more. We had college campuses and professors and students. So it's definitely not just individuals in recovery. People who are in recovery started kind of the movement. Yes.
But I think it's great to have that connection among people, and again it helps build that community, and it helps really open up people's eyes that there's people that are not in recovery that support the recovery movement, and that people that might not be in recovery get that other kind of perspective for what the recovery community looks like.
Yes, we're more alike than different.
Yes, in so many ways. Yeah. Well, that's wonderful. Well, I hope that if you're listening, you can kind of find some ways that you might be able to connect, or if you'd like to learn more, you can reach out to Callan at Haven Recovery STL, and make sure that you're paying attention during the month of September and finding those opportunities to really celebrate recovery. Yeah. So thanks for being here today, Callan.
Thanks for having me.
Thanks, everyone, for listening. If you've liked what you've heard and you want to hear more, be sure to subscribe to The PrevenTable anywhere where you listen to your podcast. We'll see you all next time. Thank you.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.